Hello there, and welcome to the Bedford Chiropractic Clinic website. My name is Satbir and I'm the Doctor of Chiropractic. What I'd like to do in this short video is introduce you to the particular chiropractic technique that I use on my patients. And we're very lucky we've got Marlene here as our guinea pig for me to demonstrate on. First I'd like to just introduce you to these boots here. These boots are specifically made for Activator, and all they do is they just allow me to sort of note any differences in leg length. But a little bit on that in a moment. Firstly, this is the Activator. This is a special tool which has been developed over 40 plus years of research. And what it does is it puts a very fast, so it's low amplitude, high velocity thrust through that point there. So if I demonstrate on this, you can see I'm not making much of a difference. All I'm doing is letting my knuckle. If I use the Activator here, you'll notice that there's quite a lot of movement evoked in the little ball there. If you imagine that ball is like a tight muscle or a tight joint, you get a vibration through the muscles and the tissues, and it actually sort of helps muscles and joints to relax. Now, we're going to start here by just showing you sort of Marlene's feet here. And if you have a look, you can see that Marlene's left foot is about a centimetre shorter than her right. This is quite common in a lot of people. If we then sort of go up, we notice that it stays short by about 2 centimetres. Now, that is an indicator of a problem in the lumbar spine. And this is from that research over the 40 years. Because what the chiropractors found, and what the research scientists found, was that there is a correlation between every muscle in the body and a segment of the spine. And knowing that correlation, I can do a complete screen of the patient's spine, starting from the sacrum right up to the occiput. And we can also do knees, ankles, hips, and also the arms and wrists and elbows as well. So we're going to just quickly go through the spine today. And as I said, what we have here is we have a lumbar problem. So if we get Marlene to put her arm behind her back, what we note straight away is that there is a levelling off there. Now what that is indicative of the fact that we have got a lumbar problem right here on the right side, which is an L4 in this case. If I go ahead and find that, Marlene knows that that is the right place because it hurts her. So if I just very gently place the Activator over that and put a thrust through, the beauty of this tool is that there is a play on there, and once you take the play out, you get an equal thrust every single time. So I know that I'm making an effective adjustment every time. If we check now, we can see that the legs are level. So what we're going to do now is we're just going to go up and check the rest of the spine. And we're going to start by just checking her SI joints and her ilium, and that's okay. If we now put both arms behind you, Marlene, and we can see that there's a difference again right there. So now, if I just go ahead and just do that, we can find that its L2 is also tight. So we adjust it, and straight away there's a marked difference. If we then go ahead and go work higher up, left arm above your head, Marlene, straight above your head, perfect. And we've got a little bit of a difference there again, so that's round T12. So we're just going to adjust there, and there we go. And if we recheck it, very good. Both arms above your head. And again, that's fine, arms back. Turn your head to the left, please. And we've got a problem right here in between the shoulder blades. A very common area of complaint. If we then just adjust that there, and we check it, and we made a difference again. Head back to the centre. We're now into the neck, and look up for me, and we can see that there's a huge difference in the neck there. Marlene, head down please, and we now reduce the thrust on the Activator because it's in the neck, and we just go ahead and adjust C5 in this case. And lift your head up again, and there we go. And tuck your chin in. And now look to the right. And again we have a huge marked difference there again. So that is in C2, so head back to the centre, Marlene, please. And we just adjust right there. And there we go. C2 adjusted. And turn your head to the right again. And again, we're fine. So what we've done there is we have adjusted, we've checked her sacrum, we've checked her SI joints, we've adjusted right through the lumbar, thoracic vertebra and the cervical vertebra right up into the occiput. So every single time a patient comes to our clinic, they get a full body treatment, not just sort of the area that's of complaint, because everything is linked. And our philosophy here is that we help you to reach the best health that you possibly can, and we try and look for the cause of your problem rather than just treat your symptoms. We look forward to welcoming you to Bedford Chiropractic Clinic.
Welcome to our office. You've made the right decision in choosing chiropractic care to serve your healthcare needs. Many patients have benefited from chiropractic care, and our #1 goal is to determine the cause of your problem and see if we can help you. This short video will provide you with information about today's visit and what you can expect. Chiropractic is based on the premise that a properly functioning spinal column is a necessary component of good health. Your spinal column is made up of 24 movable bones separated by cushioning intervertebral discs that act as shock absorbers for the spine. Just as the skull provides the protective covering around the brain, your spinal column gives protection to your spinal cord. This bony architecture provides the protective support of the nervous system while allowing movement necessary for your everyday activities. Your nervous system controls and coordinates the function of virtually every tissue and cell in the body. Through a vast network of nerves, the brain sends messages to different parts of the body to regulate the function of our body. Muscle movements, coordination, breathing, and blood flow are all controlled by the nervous system. Housed within the bony architecture of the spinal column, your spinal cord acts as the switchboard for messages arising from the brain and messages coming back from the body. Through the delicate spinal nerves that exit the spinal column at each level, communication between the nervous system and the body takes place. Looking closer, these nerves supply the joints of the spinal column as well, including the discs and the joints in the back of the spine. From the front, your spine should be straight, much like supporting beams, and from the side, your spine is composed of 3 curves, one in the neck, one in the middle back, and one in the lower back. Like the curve in a bridge, these curves provide the structure and support your body needs. Injuries, everyday activities, or poor posture can cause the spinal bones to lose their proper position, which causes nerves to become irritated, setting the stage for spinal problems, including pain. During the initial examination, problem areas of the spine are identified and their role in contributing to your current condition are considered. These are usually areas of the spine causing pain. Your spinal balance will be assessed by analyzing your leg length to get an idea of the symmetry of your foundation. You'll be asked to perform movements to contract muscles that originate from different areas of your spine. These tests are used to isolate different regions of the spine to determine if a problem exists. Your doctor will use these tests, combined with other measures, to determine areas of your spine that require attention. The joints of your extremities can be assessed using these procedures as well. When your body is found to be out of balance, the doctor will deliver a chiropractic adjustment into the problem area using a special handheld instrument called an Activator. This instrument was specifically designed to deliver a precise, quick thrust that is gentle, safe, and specific. The thrust delivered by the instrument is so quick that it accelerates ahead of the body's tendency to tighten up and resist the adjustment, producing mobility in the areas of the spine that need it most. In addition, the thrust can be regulated by the chiropractor to deliver stronger or lighter forces, depending on the area of the spine being adjusted. These adjustments are thought to reset your system, in a sense like pressing the reset button on a wall outlet. The desired effect is to provide you with effective pain relief and improved function. Based on the extent and nature of your specific condition, there are choices in the type of chiropractic care available to you. New patients begin with initial relief type care, where the primary focus is to relieve your pain and return your function as soon as possible. Once symptoms are stabilized, rehabilitative care may then begin. Periodic re-examinations will be performed to chart your progress. Specific exercises and home care measures will be suggested to aid in your recovery. And how long you decide to benefit from chiropractic care is up to you. Chiropractic care has helped millions of patients over the 100-plus years, and we have every reason to believe that you, too, should have hope of returning to a normal lifestyle. Welcome to chiropractic.